Imagine for a moment that every breath feels like a battle. You wake up in the middle of the night, not because of a bad dream, but because your chest feels tight, your throat is dry, and each tiny gasp for air comes with a faint whistle. You sit on the edge of the bed, hands on your knees, and you try to remember a time when breathing was so easy you never even thought about it. For millions of people over 60, that memory is fading. Lung cancer, chronic bronchitis, emphysema, or simply decades of city air, cooking smoke, or old cigarettes have left their mark. But here is what most doctors don't have time to tell you, and what no prescription bottle will ever say: the food on your plate can be just as powerful as the medicine in your cabinet. Not as a replacement, but as a partner. Today, you and I are going to talk about the best foods for lung cancer patients, for lung repair, for lung recovery, for lung cleaning, and for giving your lungs a second chance. And we will do it with facts, with stories, and with the kind of hope that comes from real science. Let me start with a truth that might scare you, because fear, when used correctly, is a great teacher. Every day, your lungs filter nearly 10,000 liters of air. That is like drinking 40 bathtubs of air, but without a filter. Tiny particles from exhaust fumes, pollen, mold, cigarette smoke, and even the dust from your old carpet get trapped in the delicate, tree-like branches of your airways. Your body fights back with immune cells, mucus, and tiny hair-like structures called cilia that sweep the gunk upward so you can cough it out. But as you age, that cleaning crew gets tired. The cilia slow down. The mucus gets thicker. And if cancer has entered the picture, the battlefield becomes even more crowded. Lung cancer patients often suffer not just from the tumor, but from inflammation that spreads like wildfire, from fluid buildup, and from the toxic side effects of treatments like chemotherapy and radiation. That is the fear part. The part that keeps you up at night. But here is the part they don't put on the news: your diet can change the terrain of that battlefield. You cannot always kill the enemy, but you can make the ground so healthy, so strong, and so unfriendly to disease that your body gains the upper hand. Let me take you back to a book that changed how I think about lung health. It is called The China Study by Dr. T. Colin Campbell. That book, based on one of the most comprehensive nutrition studies ever done, showed that people who ate more plant-based foods had lower rates of not just heart disease, but also lung cancer. Another book, How Not to Die by Dr. Michael Greger, dedicates an entire chapter to lung cancer. In that book, Dr. Greger talks about a compound called sulforaphane, which comes from broccoli sprouts. In laboratory studies, sulforaphane was shown to help reactivate a gene that suppresses tumors in the lungs. That is not a miracle cure, that is biology. And the beautiful thing is, you don't need a pharmacy to get it. You need a steaming pot of broccoli, or better yet, a handful of raw broccoli sprouts on your sandwich. The cooking method matters. Steaming is best. Boiling no, because the valuable compounds leak into the water. So if you are a lung cancer patient, or someone who wants to prevent lung problems, start with cruciferous vegetables: broccoli, cauliflower, Brussels sprouts, kale, and cabbage. Eat them 3 or 4 times a week. Your lungs will not turn into a clean slate overnight, but over months, the inflammation will dial down. And less inflammation means more room to breathe. Now, let me talk about a word you hear everywhere: antioxidants. But I will explain it simply. Imagine your lung cells are like apples cut in half. Leave them on the counter, and they turn brown. That browning is oxidation. In your body, oxidation happens when you breathe polluted air, when you smoke, or even when your immune system fights an infection. Those brown spots on your cells are damage. And over time, that damage can turn into cancer, or into scar tissue that stiffens your lungs. Antioxidants are like a squirt of lemon juice on the apple slice. They stop the browning. The most powerful antioxidants for the lungs come from brightly colored fruits and vegetables. Red bell peppers have 3 times more vitamin C than an orange. Vitamin C is a master antioxidant that protects the delicate membranes of your air sacs. Blueberries, blackberries, and strawberries are packed with anthocyanins, which in one study from the American Journal of Clinical Nutrition were linked to slower decline in lung function among older adults. That means if you eat a handful of berries every day, your lungs at 70 might work more like your lungs at 60. That is not magic. That is nutrition. But let me be more specific about lung cancer patients. When you are going through chemotherapy or radiation, your body is in a state of extreme oxidative stress. The treatments are trying to kill fast-dividing cancer cells, but they also damage healthy lung tissue. This is where foods that support your body's natural detox pathways become essential. One of the most researched compounds is curcumin, the yellow pigment in turmeric. A book called The Anti-Inflammatory Diet by Dr. Andrew Weil mentions turmeric as one of the most potent natural anti-inflammatories. Curcumin has been shown in multiple studies to reduce the growth of lung cancer cells in petri dishes and to enhance the effectiveness of certain chemo drugs. But here is the catch: curcumin is not easily absorbed by itself. You need black pepper. The pipe rind in black pepper increases curcumin absorption by 2000%. So when you make a golden milk tea with turmeric, add a pinch of black pepper and a little healthy fat like coconut oil. Drink that 3 times a week, and if you are a lung cancer patient, always talk to your oncologist before starting any new supplement or concentrated food. Turmeric as a spice is safe, but high-dose capsules can interact with blood thinners. Now, let me address something that sounds like a myth but is actually backed by science: lung cleaning. Your lungs are not like a furnace filter that you can pull out and wash. But certain foods help your body clean your lungs more efficiently. The number one food for this is garlic. Raw garlic, crushed and left to sit for 10 minutes before cooking, releases a compound called allicin. Allicin has been shown in studies to kill bacteria and viruses in the respiratory tract, and more importantly, it helps thin mucus. For people with chronic bronchitis or COPD, thinner mucus means you can cough it up instead of having it sit in your lungs and cause infections. Onions work the same way. They contain quercetin, a flavonoid that acts as a natural antihistamine and reduces mucus production. So if you wake up every morning with a chest full of phlegm, try adding half a raw onion to your salad, or cook onions and garlic into every dinner. Within 2 weeks, many people notice they cough less and their breathing feels lighter. Another food that deserves a standing ovation is the apple. You have heard an apple a day keeps the doctor away. But did you know that a study from the United Kingdom following over 2,000 men found that those who ate 5 or more apples per week had better lung function than those who ate none? The flavonoids in apples, especially quercetin again, protect the lining of your airways. And a different study from Hawaii followed 12,000 people for 30 years and found that those who ate the most apples and onions had a 50% lower risk of lung cancer, even among former smokers. That is huge. Apples are cheap, they travel well, and they taste like childhood. Eat them with the skin on, because most of the quercetin is in the peel. Let me talk about hydration, because nobody thinks of water as a lung food. But here is the simple truth: your mucus is 95% water. If you are even a little dehydrated, your mucus becomes thick and sticky. It clogs your small airways, and bacteria love to grow in that sticky mess. For lung cancer patients, thick mucus can lead to pneumonia, which is a leading cause of death. For anyone with COPD, thick mucus makes every breath harder. So drink water. Not soda, not coffee, not alcohol. Plain water. Herbal teas count too. Aim for 6 to 8 glasses a day. And if you get tired of water, eat water-rich foods like cucumbers, celery, zucchini, and melons. They hydrate you slowly and provide vitamins at the same time. Now, I want to build trust by telling you something that might surprise you. Not all healthy foods are good for every lung condition. For example, if you have something called interstitial lung disease or pulmonary fibrosis, where the lung tissue becomes stiff and scarred, you actually need to be careful with high doses of vitamin A and beta-carotene from supplements. A famous study called the Carrot Trial had to be stopped early because smokers who took beta-carotene supplements had a higher rate of lung cancer. But here is the difference: beta-carotene from whole foods like carrots, sweet potatoes, and spinach did not show that risk. In fact, those foods protected the lungs. So never rely on pills. Get your nutrients from real food. A whole carrot has hundreds of compounds working together. A beta-carotene pill has one. Nature is smarter than any laboratory. Let me tell you a story. Her name is Margaret. She was 68 years old when she was diagnosed with stage 3 lung cancer. She had never smoked, but she had spent 40 years working in a factory where the air was thick with chemicals. The doctors gave her a year, maybe 2. Margaret was terrified. She could not sleep. Every cough made her think the cancer was spreading. But then she met a dietitian who specialized in oncology. That dietitian told her to stop.